Okay, hopefully y'all can hear me and everything is working. Okay, so welcome everyone. Today's live session, we're going to talk all about how we can prepare for the September surge season, where hopefully there'll be more jobs that will pop up in September and October. And today we're going to be talking about how we can deconstruct our resume to prepare for this. So make sure to leave any comments or anything that you might have in the chat, and I'll make sure to address them. But before we dive into any comments or questions, I'm going to give an overview of some tips on how you can prepare your resume. But before diving into that, I want to introduce everyone. So, this is the Health Analytic Insights channel. And in this channel, we talk all about how to pivot and break into the field of health informatics. And in this channel, we really want to focus on how we can further continue to develop our skills, even when we get into the health informatics field. So, it's been 5 years of me creating content on this channel. And I'm really grateful for all the people who have left comments and have sent emails to my inbox, healthanalyticinsights@gmail.com. It's been great to get your engagement. And yeah, celebrating 5 years of this channel. So without further ado, I'll jump into the session. So I'm really excited to talk to you about resume tips for professionals looking to pivot into the health informatics field. So, whether you're coming from a clinical background, IT, project management, or another field, this session will help you strategically position yourself for success and provide you with tips to upgrade your resume. This is designed to be an interactive session, so feel free to leave your questions or comments in the chat and I will address them. So, before we dive into resume specifics, I want to emphasize something critical. Your resume is not just a listing of your past jobs, it's also a tool to showcase how your skills align with your future career goals. So before you even open your resume, you need to get clarity on where you want to go. So let's really break this down. First, ask yourself, where do you want to be in the next few years, the next 5 years, and the next 10 years in your career? A great way to do this is by saving job postings. So, this is what I personally do. If I see a job posting that looks kind of like a stretch role, something that I might be able to apply to in the next maybe 5 to 10 years, I will save it and figure out what skills I need to do in my current role in order to get to that level. So, for example, if you might see in a job posting, 2 to 5 years of Power BI experience, but you're currently building reports in Excel, you might want to have a conversation with your manager and see if you can kind of transition into using Power BI and recreate some of the reports that you're building in Excel, but using it through Power BI. Another example is if you're currently a nurse, you want to transition into health informatics, look up roles like clinical informatics specialist, health data analyst, or electronic health record implementation consultant. And save these postings and note some of the common skills you see. Also, note if there are any certifications or experience that is required or recommended, and what responsibilities excite you from these job postings. So this exercise can help identify any gaps and help you create a roadmap for upskilling. Now, another key decision you might want to look at when it comes to reflecting on your resume is, do you see yourself moving into a managerial role, or do you want to maintain um, a role as an individual contributor? So do you want to become a people manager and help people, guide people and mentor people, or do you want to really focus on your current role and really get good at whatever technical skills are required in your role? If you're aiming for management, start looking at job descriptions for roles like Health Informatics Manager or Director of Clinical Informatics. You'll notice many require leadership experience. If you don't have leadership experience yet, you might look for ways that you can, in your current role, get experience as a leader. So, could you mentor a junior colleague, lead a small project, volunteer for cross functional teams? So, in my own role, um, we have an analytics organization, and they host several different analytical themed roles, such as a data competition or a roundtable where people can talk about data related topics. And so I have volunteered as a communication leads on one of the roles here to be able to get some type of leadership experience leading a small project. That's an example of how you can, in your own organization, really figure out how you can kind of upskill without having to switch completely different new jobs. And so, again, if you have any comments on your resume or things that you'd like me to answer, feel free to leave it in the chat. Now, if you prefer an individual contributor role, focus on deepening your technical or analytical skills. For example, if you're interested in data analytics, you could propose a small project at work where you analyze patient outcomes data. Even if it's not part of your official job, demonstrating initiative can be a powerful resume booster. I'll just take a quick water break. So now that you've had the time to really reflect on your resume and see where you want to go in the next 5 to 10 years, the next step is to really align your resume with your target role. So here's how. Hi, Christina. Hope you're doing well. Thanks for joining. Again, if you have any questions, Christina, about pivoting into this field, feel free to leave it in the chat. I just went over the first step, which is reviewing your resume and seeing kind of where you want to go in the next 5 to 10 years, and then seeing in your current role if you can upskill. So once you've done this kind of reflection, you want to extract keywords from the job description that you're interested in. So health informatics roles often look for skills such as, do you have experience with electronic health records or electronic medical records, such as Epic, Cerner, or Meditech, to name a few. They also look for skills, data analytical skills, such as, do you have experience writing SQL queries? Are you able to extract and manipulate data using Python or R? Are you able to visualize the data using Tableau or Power BI? They also look for skills in quality improvement. So, do you have certifications in Lean or Six Sigma? And then also regulatory knowledge. So, I'm based in Canada, so we have the Personal Health Information Protection Act, which talks about data privacy and your healthcare information. But whichever region you might have expertise in, you want to know the legislation in your specific region. And if your job mentions quality improvement initiatives, one tip I have is think about times when you've improved a process. So maybe you've streamlined patient intake forms, you've reduced errors by 20%. Adding quantitative figures is key to add to your resume, as it helps to tell the impact. And really start to research some of the key issues in the health informatics field. Clinician burnout as a result of documentation burden when it comes to documenting notes and patient records in electronic health record has been a huge issue. And they're really trying to apply a lot of technology to reduce this burden for clinicians. So if you can think about some of the key issues in the health informatics field, and if you have any expertise, maybe applying a technology lens to improving these key issues, that's another great thing to include in your resume. And then it's really key to highlight any transferable skills. As I mentioned before, a lot of people, this is their second career when they're working in the health informatics field. They're often pivoting from another career. So if you're coming from nursing, emphasize your knowledge of the clinical workflow. If you're coming from IT, showcase system implementations or troubleshooting that you've done. And if you're coming from administration, highlight project coordination or compliance work you might have done in the past. And so you also want to include any relevant certifications or any plans you have to obtain them. So certifications like the CP or I know EMEA has their own certification as well. So you can list any plans you might have for obtaining these certifications if it's relevant to the job description. And so before we wrap up here, I want to provide a few extra tips to help your resume stand out. So you want to use a clean applicant tracking systems friendly format. So avoid graphics, no need to put any AI generated headshots in your resume or fancy templates, a brief outline of, where you worked and the time period that you worked there, and then some bullet points on the experience that you have and how it's relevant to the job description is completely fine. You might want to lead with a resume summary if you're transitioning from another field. So, for example, clinical professional transitioning into health informatics with 5+ years of electronic health record experience and a passion for data driven healthcare improvements is a simple resume summary you can include, and can help the hiring manager to generate discussion with you to talk about your previous job and how it's relevant to the health informatics field today. And then consider adding a skills section. Make sure to tailor it to each job application and include concrete details, how you actually use these skills. Don't just list Power BI or um, SQL. Speak on how you developed a clinical dashboard in Power BI to track readmission rates back to hospital. And I'll just hold on here, just post uh, something really quickly. Give me a moment to find it. So I have an ebook here that really summarizes a lot that I've been talking about when it comes to providing tips on your resume. And I just posted a link in the chat if you're interested in checking it out. So if you're looking to up level your data visualization skills and are looking for a project, I also have a course that I will link at the end of this, which can help you to improve your SQL queries and also Power BI visualization tools. So I have a comment here from Christina. Would you have any recommendations for people who come from a different background and want to gain access to Epic training? That's a really great question, which I often get, and unfortunately, I don't have a good answer because oftentimes you need Epic to sponsor you to actually get experience with the Epic training. One thing that I've seen recently, which is something to caution yourself, is I've seen a lot of videos on social media which have stated that they will give you Epic certification training. And I just want to caution you that some of them might be a scam because really Epic is very proprietary with their software. And oftentimes, either you have to work for a hospital that will provide you with that training or Epic specifically. There is a video that I saw that I thought was quite interesting that I don't think is a scam, which is helpful, which I'll just try and find here, which might be a good resource. This person, he was trained by Epic previously, and he had mentioned that if you have access to a hospital, you might be able to use your hospital credentials to be able to log into that. So I'll just try and find the information here. One second here. Try and find this link. Might be relevant. Just 1 second. Try. In here. Oh, okay. Here I found a link to it. I'll just put this in chat. But yeah, I would just caution you when you're looking for Epic certification, just don't be scammed because I've seen several videos on social media promising, for hundreds, $200 a month that they will certify you with Epic. And from what I've heard, the only way that you can really get Epic certified is through the healthcare organization or Epic themselves. So yeah, hopefully that video that I posted in the chat will be helpful. But yeah, it's not easy at all. I would suggest also looking for EHR analyst job postings, um, application specialist postings as well too. That might be a way to get trained in this field. So yeah, and the last tip I have for formatting your resume is just to keep it concise. So 1 to 2 pages max. You don't want to have 4+ pages in your resume because hiring managers often have many resumes that they're going through, and that might work against you if a lot of your relevant information is like on page 3 or 4 and they just don't have the time to go through it. And remember, your resume is a living document. As you gain new skills or complete projects, make sure to update it and always keep it relevant because it can be very stressful when you're, starting to apply for jobs and you have this big hurdle now of having to revamp your whole resume. So, especially when you have a job, just try and update your resume as you go along. So, before I wrap up here, I just want to recap. Define your career goals by researching roles. Make sure to save any stretch roles that you might want to apply to in the next 5 to 10 years. Decide if you want to pursue management or if you want to stay in the individual contributor role, and seek relevant opportunities that can help upskill you to be able to grow either into a leadership position or deepen your technical skills if you want to remain in the individual contributor role. Tailor your resume with keywords, quantifiable wins, and transferable skills. And yeah, that's the last of the tips that I have for structuring your resume. I hope this challenge was helpful and helped you to prepare for the roles in that hopefully we will see in September and October. I know it's a very difficult job market. It's really hard to continue to apply and not hear back from people. I've been there, and I hope that whoever is listening and watching that they will hear back soon and will get a role that is best for them. I don't see any more questions in the comment section. I'll just leave my email. And this will be, I'm going to end the stream in about 10 seconds, but I have a newsletter and it will be in the replay of the newsletter, so you can come back and listen to this. But I appreciate you taking your time, and I hope you have a good rest of the day. Thank you, Christina, for joining. Much appreciated. And I hope you have a good rest of the day. Thank you so much. Bye.